been an MLA, full-time politician since 2010. I've been involved in part-time politics since 2005. And I don't think I have ever read a consultation document that was easy, first of all, to follow, and secondly, easy to fill in if you're a member of the public. I'm an electrician by trade, 20 years in the game, 10 years of foreman. People sometimes ask you what university I went to. I say I went to my university was the Building Sites of Belfast. So for an ordinary person, it's very hard to actually read an official government document, let alone try and understand it and fill it in. So it is a fair criticism that I make quite a lot in every art and part of government, in every department, that their consultations aren't really designed for a public intervention, and that they are designed for certain sectors and certain professionalisms and certain expertise. That's not necessarily the right way to do it, because when something is so important as public health that has affected every single one of us and every single one of our family members, I think it's only right and proper that they would have took a different course or a different action on this public health bill, given what we have lived through and given how we've been affected. And I think they could have made it easier for the public to respond, but they haven't. And I think what they're getting now is they're getting heat. There's a massive run, I believe, from ordinary members of the public trying to respond. And even if you can't or you don't have the time to go through all of the pages, all of the 50 odd questions, some of which are quite opaque and vague, then, just write a personal, heartfelt letter of what you have experienced throughout COVID and why you wouldn't think that that would be a good idea leading into the future, and the damage that it has done. And just write an ordinary letter to the Department of Health through the channels in which they advertise. What I would guard against, and I understand why people do this, because people are busy, people maybe haven't the ability, but I would guard against a petition type template letter or even a petition, because government departments just bat those away so easily. They basically just bat them away as a petition type letter that somebody has signed the bottom of, just like you would do with a petition. And then, of course, they rubbish petitions because, okay, there's 10,000 signatures in this, but do these people realize what's the detail of the bill, the proposed bill? And so they rubbish that too. And of course, there's nothing to stop the Department of Health, if they are determined enough, to ignore the consultation responses in any consultation. And there has been history in the past that departments have done that here in Northern Ireland. And I'm sure it's the same in Westminster, and I'm sure it's the same in Scotland and Wales. So I do believe that the Department of Health are determined to bring in these draconian measures onto a permanent footing.